Okay, Anna, it's 9:30. Let's go ahead and get started. Let's get this recorded. Good morning, everyone. This is MnCHOICES office hours for Friday, December the 6th, 2024. Thank you very much for attending today. On this slide are members who are attending our call for today. Please note that Catherine Katie from Housing Stabilization Services is joining us today. We have an additional slide on Housing Stabilization Services added to the PowerPoint from a question from last month. So we asked Katie to come back in case you had questions. So thanks, Katie, for joining us again. So this session is being recorded. We use web audio you use it to listen to the session. We have you all muted. And the reason why we do that is it reduces your background noise. When you have a question, you'll raise your hand to ask the question. And then we have our facilitator today, Amy Alexander, will ask you to she'll call on you and then she will unmute you so that you will be able to ask a question. An item that we added to the slide is, hey, when they call on you, will you please then restate your name and your organization and kind of like what kind of work you do or where you do your work? Because sometimes for us, we have to get our heads around where your question is coming from, and having, like you're a certified assessor or you're work and support planning for elderly waiver or something like that just helps us to get our head around the context of the question a little bit quicker. So if you could do that by stating your name, your organization, and kind of what kind of work you do will help us in answering your question maybe a little more efficiently. So let's go over the ground rules. We do this kind of every call, but all parties to this call, we're really here to support an atmosphere of good intentions and respect for each other and this call. DHS staff is participating to provide you information on your agents that your agency might need. And agency mentors, you're here attending the call to learn and ask questions so that you can take those answers back to your agency. We are to be respectful of all the other people who may also have questions. We really want you to only ask one question. You can get back in line as soon as your question's done. You can raise your hand again and get back in line to ask another question. But we just want to make sure everybody gets a chance, hopefully, to ask the questions that they have. We're also asking you then to refrain from asking questions that you've submitted on the help desk form. And the reason for this is usually when those forms come in on the help desk form, they require a little bit more research, some conversation between different policy groups, and they take a bit longer to come back with a good response for you that is informed kind of with everyone's perspective. And so please don't ask those questions in this office hours call because we won't be able to answer them. So office hours, if you go to MnCHOICE's partner link mentor page, the schedule for office hours calls are there. You can submit office hours questions using the survey link that is on that page. And I pull those question groups 2 weeks ahead of time and review them to see, have we answered them before? Should the question be in office hours? Is there another way that we need to address the question? So we look at them all. So just so that you're aware, and then we determine what to do with them. And then sometimes they get included then in office hours as well. Our agenda for the day is as follows. First, the help desk will do their update. Then we'll go through training and other key updates that you need to be aware that we've made. Then we will walk through last month's system updates and additions to the CFD, and then we will have time for your questions. I really recommend that you, as I'm tooling along in this presentation, to mark down the slide that you have a question on. I so appreciate it when you say, could you go back to slide 14? It makes it very easy for me to then get to where you had the question on. And so I'm very much appreciate when you provide me that kind of reference. So thanks a bunch. So let's start this morning with the help desk updates. I understand, Kong, that you are doing the help desk updates today, and welcome to the call.
All right. Okay. So, hello everyone. I think Teresa, you got the next slide there. If you could go on to that. All right. Thank you. All right. So, a couple updates here. We have been hearing from users on these two items here. The first one is the logging into the MnCHOICES, and you're experiencing the being stuck at the acknowledgement screen, having to refresh the page. Um, so this issue is mostly a cache issue. Um, Site data is a form of cache that helps provide a smoother or quicker experience when you're working in the application. And it also helps make each user session less taxing on the network and server resources. So um, it helps all around to just make the experience a little bit more smoother for for you and everybody else because it's less taxing for the entire network and server, right? And it's also used for offline mode as well. So when you're going into offline mode, your data is being stored in the site data. Um, Clearing cache can help, but it's not necessary because that would mean that you'd clear your cache after each session, basically. So, um, you know, after you're working in there, you would clear cache, and then the next time you log in, you won't experience the being stuck at the acknowledgement screen, right? Um, More importantly, clearing cache, it's gonna delete offline mode, so it's probably should not be a usual practice to clear cache all the time. So the best option is to just refresh the browser whenever you know you're stuck at the acknowledgement screen. Just refresh the browser. It takes a second to do, and then just log in. That's it. So that's what I would recommend. The only other thing is make sure your URL is just simply minchoices.org and it's clean. It doesn't have a lot of trailing characters and stuff like that. So that's something to check. So that's that's it for that one. Simple. Uh, just refresh. Hmm. You can clear cache if you want, but just refresh. It's the cleanest, simplest, and fastest way. Um, the next one here, number two, name and date of birth changes to the records. If you're seeing discrepancies, and this is in the person profile to the name and date of birth, um, the data is coming from Swindex. So Swindex is fed with Max's data and county data. So it's very likely that you can check with the SSIS uh, liaison or Max's liaison and get it corrected there. And then that should flow to Swindex and then MnCHOICES. And you'll want to check with us. We can ensure that it'll get reflected to MnCHOICES as well. Uh, all right. So I have a update on the printing issue that we've experienced in the last couple of weeks. Um, so yeah, the printing issues have been happening. The ones that we've experienced in the last couple of weeks are we've 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 had them before. We've had them in October, September, along with other printing issues. And I know they all just may sound the same to some folks because they're all printing issues, but um, some of them are different. FEI has been able to resolve some of them, but this one has been happening intermittently, and I think FEI is getting closer. Um, so I apologize. I'm not trying to bring back bad memories, but I just wanted to relay what FEI shared, and It sounds like they are getting closer to the solution. They said they've been working on a stability fix for this particular issue that happened in the last couple of weeks. So hopefully, we can look forward to having this issue be put to rest. All right, this last one here involves adding the waiver provider in the support plan. We have some users encountering an error when they try, and FEI's analysis said that prior to the October release, the plan owner used to be pre-populated with the staff information, whoever created the support plan. Following the release, the plan owner field now requires the staff to select the user from the drop-down, the plan owner drop-down. So if there's basically the error is occurring because the support plan was created before the October release. That was October 17th. So now the user just needs to reselect the plan owner again. Basically, the resolution is go into the support plan, remove the plan owner from that plan owner dropdown, and then reselect the plan owner. If if the right plan owner is not showing up, you just have to ensure that the plan owner or whoever the staff is actively assigned, and then you'll go in there and put in the plan owner, and then you can finally add the waiver provider and it should work. So we have these instructions available at the help desk. Feel free to contact us and we'll get it over to you. And if you have any other questions, feel free to just reach out. And that's all. Thank you.
Thank you, Kong, very much. So our next item on our agenda is to talk through the training and other key updates so that you're aware of things that have been changed since the last release. We're working to try to have each of these resources, Partner Link, Train Link, and Help Center resources updated to coincide with the release. So that is our goal, and that's what we're working towards. We also want to make sure you're aware of those changes so that you know items have been updated and what has been updated and when. So one thing I wanted to make you all aware of is we often hear, hey, are there opportunities for certified assessors for continuing learning units? And the Elderly Waiver Foundation's 2, the second in the series on elderly waiver, is now available. It's in and live in TrainLink. And so if you would like to take the Elderly Waiver Foundation's 2 training, if you've taken one, it is now available and you can use it for your continuing learning units for recertification. If you're a certified assessor, of course. So MnCHOICES training updates. When you look at these updates, you'll see this first one is the Access and Navigation series. So MnCH 900 course. And in the person record module in particular, we made an update to it on November the 7th. Part of what we added to it was the sections in the MnCHOICES. So a list of profile sections in the person profile so that because that list wasn't complete, and so we updated it so it was complete. And we introduced the MnCHOICES user manual. It lives in the help center because we realized that we should probably put that in that series for access and navigation and make it early enough so that users were aware there was a user manual in the help center. And so we added it to that module. And then we also added, as part of one of our last office hours, we talked about where addresses auto pull from. They pull from the United States Postal Service database. And so we added that also to that module, specifically letting them know or letting people know that, hey, if the address isn't right, if the township doesn't show up, here's where you report that information to get it updated. So basically updating the US State Postal Service database. And then also there is now a slide that instructs the user to that MnCHOICES uses a disability certification status in the person profile to determine eligibility. So they need to update that if a disability certification is changes because it does affect eligibility determination. So we wanted to make sure that was added early so people were aware. And then in the Forms Access and Navigation module, we added a slide for users not to add emojis and text boxes. Again, we're working to, if we provide you instructions in office hours, to make sure that they then get added to training, because often I have heard you say in the past, well, I wish that slide was somewhere where we could refer to it. And so we're working really hard to say, okay, when we put these slides in office hours, how do we make sure they get to training and to resources? And so, and then not adding emojis in text boxes will also be added to the user manual as well in a future date. So in the MnCHOICES workflow health risk assessment, so the course number is MnCH 911, starting an HRA module, we added into slide 17 that information copies over from the previous HRA, and if the care coordinator selects the person declines or the person's not located in their HRA, then that copied information will be removed. And so we just wanted you to be aware that we added those and we added that information in there. In the workflow support plan, safety, well-being, and signature module in November, we added 2 slides from office hours. One was to talk about using the print function in the support plan, and that to then indicate, so you select the signature, and then that you can use that to collect the handwritten signature and then upload it. And then we also, in slide 18, added how to review a handwritten signature because that also came up in office hours. And so we added it as well. In MnCAT Step 2, the State Plan Services module has been updated. You can take it as 200A if you want to see, if you've already had your certification and you want to look at that information. And so what we did is we added the CBSM page now that it exists. We edited the questions so people research them from the CBSM page. And so you'll see it in slides 3 through 8 in that module, those changes. If for some reason you can't see the changes, like you go there and you can't see the changes, when you log into TrainLink, you'll see this and you bring up the course, you can go under your name and click Restart Course. And then with that Restart Course, then it will update your course. If you don't want to do that, you can instead go to a different browser and log into TrainLink and you should see the changes. If you would prefer not to restart the course, it's usually because your browser saved the cache from your last instance of using it. And so then restart your course is really the best option. We also wanted you aware of the fact that we have a new resource available out there called MnCHOICES Certified Assessor Resource Guide for Working with Interpreters. We created it for certified assessors, but this interpreter guide is as valuable for care coordinators and case managers. We developed it out of funding that grant funding that we received specifically for certified assessor training. What it does is it provides, it's really there to improve access for people with limited English proficiency, providing a resource for agency staff who might have questions about working with interpreters, and it also provides useful information about, for certified assessors and other folks, like I said, best practices for working with an interpreter specifically, and it has sections on before an assessment, during an assessment, and after an assessment visit. So you might find that this resource will be useful to you. It is out on eDocs. It is part of the 6791 series, and its last letter is T. So next thing on our agenda is to go through all the system updates. We're going to look at the outage schedule, the release fixes that aren't in the CFD, the release fixes that happened after this last release, and then items new to the CFD, and then your pre-submitted questions. So let's talk about the items that were fixed that weren't in the CFD. Okay. So what we were seeing is only staff with a certified assessor role or care coordinator role were able to edit the date sent field in the assessment summary introductory letter. And a permission was added for the support staff so that now they will be able to edit that date sent field as well. And they'll be able to move the MnCHOICES assessment status form from in progress to MMIS ready. So that change in permission allows for support staff to do a couple more items. So the next one that wasn't in the CFD but was fixed in this last release, in the November release, is in the MnCHOICES assessment summary section, summary of your assessment subsection, the text was required in the completed by assessor and recommended by assessor fields to save. So you had to have them both done to be able to save the document. And what has occurred is now you don't have to have them complete to save the document, but when you get to a place where you need to finish your work, you'll need to have them done to meet the completion requirements. So they're not required to save as you work your way through the assessment, but they're required to be complete before you can move the status to approved. The next item that isn't in the CFD but was fixed is the completion alternative care and waiver program section of the support plan signature sheet. Displayed statements and information that we'll say is incorrect. Users were unable to indicate how much time the person would use a service or the supports that are not in CFSS, and so that was resolved. The screenshot is here to help you understand that a little bit. So the CFSS and alternative care and waiver program sections of the support plan signature sheet. So this section in here now displays when a person is eligible for CFSS and waiver and the budget information. So that includes CFSS time or total CFSS minutes planned for an alternative service will display on the support plan signature sheet based on the selected responses and how the person chose to use CFSS. So it will now display as expected. The next item, a person's case mix did not display on the support plan for all program types. So this is my example of that without putting information in it that either may be incorrect. So the case mix will now display on the About Plan screen in the Budget Information section of the support plan for both the MnCHOICES Assessment Support Plan and the MnCHOICES MCO MnCHOICES Assessment for both CADI and BI programs. The case mix will also display in the support plan printout. The case mix will continue to display for EWAC and Temp AC program types. So it's really a change for CADI and BI. Within the Get Rate screen, so the next one is within the Get Rate screen of the support plans for the elderly waiver, customized living, 24-hour customized living, adult foster care, and adult corporate foster care. In the elderly waiver residential services tool, there were subheadings called error and warnings, and the field labels and messages were a bit unclear for folks or caused them confusion, and so those errors or warnings were cleaned up. So now when the change is made, you can see in the visual that's on the screen that the errors and warnings now just say error and warning. They no longer have something that follows them, where before 24-hour customized living does not qualify for customized living. It now just displays error, and for 24-hour customized living and regular customized living, that warning rate plan exceeds limit has changed just to warning. And for the adult foster care and adult corporate foster care, the warning rate exceeds case mix budget has also been removed, and it just displays warning empty. And the reason for this is then if there actually is an error or a warning, it will display underneath each of those sections, but you won't have something running next to the title error or warning that caused users confusion. So that items were removed. So the last one that they fixed that wasn't in the CFD is lead agencies have used the statewide certified assessor list on partner link as a reference to verify certification. A new report was added to the called the assessor certification status report, and it's now available for lead agencies to monitor certification status. And then an additional communication was sent on that as well. And so um, So now that report, if you have a role of agency reports, lead agency security admin, supervisor for a lead agency or a delegate agency or a contracted agency, you can see reports in the heading. And when you click on them, you'll see the certification status report. So you can select it. Then what happens is it opens up that page and you'll see there's two tabs, a summary tab and a detail tab. In this instance, my summary tab is showing all of the organizations in the state of Minnesota, but yours will show yours. And so it will show you, the summary tab will show you the organization. You can choose the organization, the location, the user, and the number of days. My recommendation to you is that when you make these selections, make as few as possible, give yourself more data instead of less data, and then you can narrow the report based on what you want to know. But as you get used to using it, leave it a little wider until you get comfortable with it, and then narrow it as you understand it better. So it's like anything else, we have to learn how it works. So the detail tab provides a bunch more detail. So what'll happen is if you are in the detail tab and you hover in the right-hand corner of that page or on the above the top of the table, if you use a JAWS reader, it should be before the table where you would see the options to choose from. You'll have the options of filter, focus mode, or ellipsis. And the filter is going to give you the options to search for results. And so if you click on it, it'll give you those options. Focus mode removes all the search results. So basically it makes it one big screen so you can just see the data without seeing everything that's on the edges. And then it has a back to reports button that you can use to take you back to the reports. And then the ellipsis provides other options. It includes you can export the data as a table, you can spotlight it, you can look at insights, you can change the sorting order and what you want it to sort by. And export allows users to pull data into an Excel spreadsheet, and then you can change and sort it there. So if you find that you're using the org location user in the summary gets too small and you want to see it larger or you want to sort it different than MnCHOICES has for sorting options, you can always export it and then sort it outside of the system if that works better for you. So it allows for that as well. Because of that change, because we put that report in the system, then the certified assessor, statewide certified assessor list has been removed from MnCHOICES from Partner Link. And we updated the recertification instructions to mention the report as well in MnCHOICES. And then we also updated the lapsed assessor protocol, and those where you can see were loaded in at the time of the release. And so of the November release. So DHS will continue to monitor assessors lapse more than 30 days, and we're going to do that on a quarterly basis. Through the time of this launch, we haven't done it, but we will start doing it in January. And we're just looking at, are there folks out there who are completing assessments that have been lapsed for over 30 days, making you as an agency aware that that is occurring, and then talking about, have what's going to happen with this person? Have you updated their credentials? Some of those kinds of things. And the protocol speaks to that and to the timing, which is part of what we updated as well. So the next item on the list, we're going to go through the November release fixes. There were 8 of them. So in the person record progress notes, the MnCHOICES system would convert some dates in the note field. If you put in the date and put slashes in, so in the example on the visual on the right is 11/14/2024 would sometimes change to a decimal. And so with this fix, the slashes are retained for slashes between the dates, or you would use them for other things, and so this error no longer occurs. The next item, the MnCHOICES assessment results heading. The MnCHOICES application did not provide additional time for eating. It's a critical ADL dependency when a person is younger than 18 years old. This applied to a person who needed tube feeding, GI tube at any frequency, or tube feeding, any tube feeding event that lasts 12 or more hours per day. The changes made were 30 minutes of additional time for the critical ADL dependency of eating will be included when a person is younger than 18 years old for tube feeding G to J tube at any frequency, or tube feeding any other tube feeding event that lasts 12 or more hours per day. So that change then accommodates what we all expected to see. The next item, the MnCHOICES assessment summary. The assessment items are grouped into categories representing assessed need, which are shown in the assessment summary, and then they're carried over to the support plan. However, the category of self-preservation didn't include risk of self-neglect and vulnerability in relationships. And if a person has a need in one or more or both of those areas but lacked any self-preservation needs, self-preservation did not display. So what we're saying now is that with this November release, the self-preservation category of need will print to the assessment summary and carry over into the support plan when a person has a need in the risk of self-neglect or vulnerability. And so then it displays, self-preservation does display. For the MnCHOICES assessment summary, appeal information was missing from the assessment summary printout for assessments that were created after August 23rd, 2024. With this November release, the appeal notice instruction information included in the assessment summary printout when the response was, "I am the care coordinator and need the staying healthy section," was yes, staying healthy with action, notice of action and signatures, or no. So now that appeal notice displays as expected. So sorry that sometimes reading those headings is a little clunky. It makes it hard to understand, but the point here being the appeal notice has been returned as expected. For the MnCHOICES assessment screening document heading, if a marital status was other, common law, or living with a partner, the marital status field on the LTC screening document was blank. And so the picture to the right shows the LTC screening document marital status now showing a value. And those values then are for other, it's 99. For common law, it's 01. And for living partner, it is 01. And so that value now displays for marital status for those 3 options. Support plan. For anyone accessing only DD Rule 185 case management, the system displayed questions about choosing to waive the assessment, whether the person did or did not waive their assessment. So with this change, the additional attestations about a person's choice to waive their annual assessment will only display on the support plan signature page when yes is selected to "I choose to waive this year's annual MnCHOICES assessment," then they'll show up. So for the support plan heading, when PCA T1019 or T1019 19TG are entered into the support plan, the CFSX section does not appear, and the users are not able to enter information about CFSS representative, diagnosis, and PCA supervision. Changes were made so the CFSS section of the support plan will now display, and the users will no longer have to add CFSS information to the support plan instruction section on the service planning part of the support plan. For the support plan printout, the system showed that a person on EW with case mix L was eligible for customized living for a support plan MnCHOICES assessment or a support plan managed care MnCHOICES assessment, and the system allowed a user to calculate a rate for 24-hour customized living. However, case mix L is not eligible for customized living. And so with the change, a person on EW with a case mix L will no longer show as eligible for 24-hour customized living. Again, MnCHOICES will work as you expected. Or support plan. So this is a new item that was added to the CFD for November. So the support plan printout, when printed, support plans with a transition plan as a reason for them are missing information. The daily rate is incorrect, but the EWRS rate information does not show assessed need and the service time increments entered by the user. So what you'll do is you'll print the rate inputs from the web browser or hand correct the support plan printout as a way to deal with that. So there was an item updated for the CFD. In this slide, I have changed the color. If you cannot see red, I'll explain to you what the change is in this to make this a little bit more clear. So what's been updated is a user can change the effective date range in the overview section of any support plan after services and supports are authorized. This may cause the services and supports to be authorized outside of the service span. This means the support plan with an updated effective date range cannot be, and it used to say changed, that's been crossed out, and instead the word revised has been added to the description. Because what they're saying is that you can't use the revise in the support plan to make that change. So to change, the directions are to change the services and supports to be within the support plan span first, if the effective date range must be changed. And then they also then added, if a user authorized services outside the effective date range and the status of the support plan is plan approved, the user will need to create a new support plan. So the last sentence in this slide is what was added as well. So we're going to take a minute and look at a couple of questions we got from you, and then we're going to open it up for questions. So I'm going to, hang on, I'm going to just give you a sense of timing so you can get yourself in queue. I have 3 slides and then it'll be time to ask questions. These first 2 are on housing stabilization, which is why we have Katie present with us today in case you had further questions about them. And then the last one is about the support plan HRA. So I have 3 slides. So for housing stabilization, one of the questions that came out of our last office hours was, hey, can you talk a little bit about state plan services that meet the threshold for housing stabilization but aren't eligible for waiver? So the instructions for people who do not have waivered or targeted case management or MSHO MSC plus care coordinator but need housing stabilization services, you don't have to complete a MnCHOICES support plan. Instead, you complete an assessment summary and provide the person there's that 6791A MnCHOICES assessment worksheet, and the person will complete their person-centered plan needed through an enrolled housing consultant. And the next slide talks to you about how to do that. So I have a link here on how to locate an enrolled housing consultant. And then the enrolled housing consultant helps a person develop a housing focused person-centered plan and supports the person to select housing transition or sustaining provider. And so the screenshot on this is when you click on the link for how to locate an enrolled housing consultant, it'll bring up a search engine and it'll allow you to search for a person. And then if you want more information about housing stabilization, the link on this page will take you to the CBSM page, I believe. I can go see if I can. So it takes you to here. It takes you to the housing stabilization page for the partners and providers DHS page. So that's where that link will take you so that you can have more information about housing stabilization services by reviewing that page. And then also notice that there's a place where you can put your email address to receive updates. So lastly, prior to when HRA services were added in the support plan HRA services that support me, you were creating other support plan with the program type other, and your question was, what do we do with those plans if we need to revise them? We now need to revise them. They have other, but we know those services are available in the services and support section. So when changes are needed to be made to those forms where you had other, you can revise the plan and add the services in the services and support service type services that support me section. So you don't need to follow the old instructions. You can just go ahead and add them as you do in plans that you then created after that release was done. So that gets me to the end of my slides. I have my slides up on another screen, so if you need me to go back to a slide to refer to something, you can. You can go ahead and raise your hand and Amy will call on you. Amy, I'm just giving them a little bit of time to get their hands raised, but I think that we are ready to go.
Yep, and we do have a few.
Okay,
hands
yep, I'm just unable
raised.
to see it, so sorry, Amy, I don't mean to be talking too much. Go ahead.
No, that is okay. We do have a few hands raised, and I'm sorry, I'm trying to go in order of when they were raised, but I'm having some issues with how they're organized in my view, so I apologize, but I'm going to do my best. So we first have Mary W. I'll unmute you now. You can go ahead.
Morning, Mary.
Mary Woodard, your line is unmuted if you still have a question. All right, we'll come back to Mary and we'll move to the other Mary. So Mary Birch, I'm going to unmute your line and you can go ahead.
I had a question. I am adult worker in DD at Hennepin County. One of my unit members was adding modifications, assistive technology, and equipment to the support plan using the T2029 UB. And it states on there that these items do not affect the budget, but yet they do. There's not an area to put the costs of what the items are. I believe it was like wheelchair adaptations, things that MA would not pay for. Is she doing it correctly by putting it under services that support me on a DD waiver? And do we need to worry about those costs?
She's adding other services into, I just want to make sure I'm understanding. I missed the beginning of your question.
Okay, she's adding
other
mods.
services.
Yeah, she's doing it under services that support me, like she would on a DD waiver. And then she chooses really the option for modifications and equipment.
The waiver service of modification and equipment?
Yes.
So she's entering from provider information. I would be entering that kind of the things that are covered through MA under assistive technology, not services that support me. Because anything that's a service that supports me will add up as part of the budget, but you could do that as services and assistive technology. I don't have the exact word in front of me, but you could do it as that, and it shouldn't impact the budget.
She wants the amount added into the plan, so it is going on the waiver. It's waiver
Oh.
funded.
Okay.
It's
Then
not
you're
MA
saying-
funded. That's why she's putting it under services that support me. The person's on a DD waiver, and it was like wheelchair equipment that MA would not pay for. So she's going
Okay.
through the waiver. And when she puts it under mods, assistive technology and equipment, T2029UB, there is no area to add what the cost of the items were for the provider that provided the equipment.
Let me go in and take a look at that really quick, and
Sure.
we'll go in and take a look at that really quick and get back to you.
Sounds good.
We'll try to respond back in this meeting. Thank you.
Thank you. Yep.
Thanks for the extra explanation too.
Yep.
All right, so we'll move to the next question, and it's Emily Gerard, and I've unmuted you, Emily. Go ahead.
Good morning. Can we go to slide 44, the one right before this question slide about the HRA and revising and the plan types? I'm thinking maybe I'm not understanding and maybe I need more coffee this morning. So if we previously opened the HRA support plan as other, because at the time that was the only option, and now we go and just use the revise function, isn't the form type going to perpetually stay as other and it's never going to list it as program type HRA? Because when you revise it, it all
Correct.
stays original. So is it okay to continue to have that other type so that we don't have to start fresh as HRA?
Yeah. That was the question. And so the question is, yes, it stays that way. And you can add now the service and the services and supports, you know, when you pick that type and then
Okay.
put it there, and it will
Okay.
work, even though that
So it
plan
will,
is going
it
to
will
stay other.
function just as if the HRA type is picked, even though on
Yep.
the main forms page, it will still say other.
Correct. That was the point, to verify
Gotcha.
that was
Okay.
the case. So thanks, Emily, for the clarifier.
Okay, yeah, I just needed to make sure I had my brain wrapped around it. That's all I had. Thank you.
Yeah, you're welcome.
All right, and next we have Ann Henningsen, and I've unmuted you, Ann.
I'm going to be asking a question on the HSS.
Yep.
I have a client that I've been trying to get this service added to her service agreement, and the procedure codes, it won't let me enter them. So I've been trying the H2015. That's for the housing stabilization services on the long-term service and support services rates form. The provider stated that they wanted 600 units at the 1717, but I can't get that H2015 U8 on the service agreement or in MMIS.
Is this one that's going to need a little more tech support? Is she going to need to submit this on the help desk form? I don't know.
Does it have to be something out of different because she is on a caddy? I mean, does it have to be like the transitional services? But because the provider stated that was the $17.17, that's what that H2015 is. I guess I'm just confused and just can't get anything entered for her.
Right. So what I hear you saying is the person is on caddy.
Mhm.
When you try to put the service into the support plan service agreement and use the H2015,
Yep.
you're unable to enter it in the service agreement and in MMIS. Is that what I'm hearing?
Yes.
Thank you. I
The
just wanted to
service
make sure that I was restating what you were saying.
Yes, the service agreement, that doesn't even come up as an option.
Okay, thank you. So you're not seeing the ability to search for and find that code.
Correct.
Thanks. Is that something we need to look into and we would like for to submit it in? I don't know the answer to this one. And no policy is having a conversation in the background, so I'm just
Yep.
giving them a little time.
Are you selecting other services when you create the plan? That yes, the person is accessing other services?
Do you want me to show where that
Probably
is, Liz?
no. I know where she's talking, and I'm gonna have to say no.
Okay, so you won't be able to add any other services without revising the plan and selecting that you want to enter other services.
Okay.
Also,
Yep.
other services do not show up in the service agreement for all program types, so it's not entered into MMIS. I'd have to defer to Katie if it's supposed to be. But currently, it is correct that those would not show up on the service agreement.
So you're saying I don't actually have to enter it on the service agreement?
Well, I don't know about MMIS, so unless somebody else can speak to that, you could send that in and we can look into it more. But as far as how it gets entered on the support plan to be approved by the HSS team, you need to make sure that you can enter other services. Then you can search by other. And I think that step was covered in the last office hours. So if you want to refer back to that.
Okay.
And no, sorry, our HSS person cannot unmute for some reason, but she is saying that they do not use the service agreement.
Interesting. Okay. It was just, the provider was asking for that number. So that's why I was trying to get it on there.
I
Because you're
think that it would
giving
be
them
something
a
that
printout of it. Yep.
well, because it's an authorized service, though, it's authorized through housing stabilization services. That I mean, they're through that. With Katie could speak about this, I think that she would say that it's authorized differently. It's not authorized on a waiver service agreement. So
Okay.
you include it as other, but it's authorized. It's paid for differently outside of the waiver.
Okay, I got that. Okay, sounds good. I will look at last month's or listen to last month's MnCHOICE
Yeah,
office hours and figure out that other piece of it.
Yeah, it's in the same section as this is, just so you know, at the end.
Oh, okay.
So if you want to advance through the recording and take it to closer to the end, that
Sounds
will
good.
help you.
All right. Thank you very much.
You're welcome.
All right, next up we have Christine Shaman. And you're unmuted, Christine.
Can you hear me okay?
You can.
Oh, perfect. Perfect. I oversee the initial assessment team. And what we've been running into is our process when we do the scheduling and assignment for an initial assessment from intake, that initiates the assessment, but there's times where we need to reassign the assessor. But whoever was originally assigned within the tool, we can't change that field in the section where it kind of autofills the assessor that was assigned. Even when you go back in and do a change into, with roles or assignments, it won't autofill the new assessor. So we always have to reopen a new assessment when that happens. I was just wondering if I don't know if there would be a fix around that could happen. Does that make sense?
Yep. So what you're saying is you discard the old one and do a new one so the person shows up.
Yes, exactly.
Yes, if you've started a form that unfortunately that field is not editable, but we can see if we can make an enhancement request to this.
Okay, thank you.
All right, next we're going to move to Ricky. And Ricky, I've unmuted your line, so you can go ahead.
Can you hear me?
Good morning, Ricky.
Hello, can you hear me?
We can.
Thank you. So I have a question and I apologize. I was in another, I didn't hear the beginning of the training because I was in another meeting, but I wanted to ask and I want to apologize if this has already been addressed in the meetings and or another office hour and or the current functionality document because we have been getting questions from some of our delegates. So in the MnCHOICES assessment, we believe under information and resources, there are 3 boxes, and I'm assuming that it's when they select the dual role for both, the waiver case manager and then also the Blue Plus Care Coordinator. So the 3 roles are the notice of privacy, practices, rights and responsibilities, your appeal rights, and then the Minnesota Abuse Reporting Center brochure. So I wanted to make sure to ask about these 3 and say if it is a situation where they're wearing dual hats, they're providing all 3 of these. Is that a true statement? And is this also one where it applies to both the HRA and the MnCHOICES assessment? And then sometimes what happens is, let's say they're not doing dual roles and they're just the Blue Plus Care Coordinator. My understanding is that some of these would not be pre-populating. And then our question is to the Minnesota Abuse Reporting Center brochure, is that something that should be given to every member, regardless of whether they're on an MCO, or only if they're doing the dual roles? I think that's a new document for me, anyways. For
So,
care coordinator, yeah.
yeah, so what I was thinking about is in a training, we review if you answer, I'm a care coordinator and it's either a yes or a no, or then the boxes display differently based on selection. And that then the boxes that display are the ones that is true for the selection that you made. I will try to look that up and tell you which one, but I don't know if anyone's got a more learned response to it than that while I see if I can find the screenshot.
And I tried to duplicate it with just a Blue Plus Care Coordinator one where it was like, that's all they needed. They didn't need the appeal rights. And I don't believe that I've seen the Minnesota Abuse Reporting Center brochure. So I also want to clarify, is that a document that every member should be getting, or is it just for those that do,
Right.
waiver case management?
So to your point is you hadn't
Yeah.
seen that on the list before. It's displaying, and what you're basically wondering is if with the selections that were chosen, are those boxes displaying correctly? Because my thought is they're displaying what you need to share, that what they say is what you need to share, and if they don't say it, you don't need to display it. But I'm not the policy person, I'm only the functionality person, so I would let policy answer that more directly.
Yeah, Teresa, we're trying to sort through it, and I think there's a couple different things at play, so it might be better to have this one submitted. I will say the abuse reporting brochure that was added was specific to a requirement for people utilizing the DD waiver who are over 18, that there's a requirement that that brochure be provided, but I can't speak to, the dual role or what's required for MCO. So I don't know how much help that is, but it might just be helpful to submit it because I think there's a couple different people that might need to weigh in. It might be easier for us to get it on a help desk form, unfortunately.
Okay, thank you so much. We will just give what is on the boxes based on what we select for now, and then until we hear differently. Thank you so much for your attention to that question.
All right, next we're going to go to Angela Dostal, and I have unmuted you.
FSS codes will be added to the support plan?
For consultation services and for, I think we had a issue, we didn't, or however we unmuted you, we didn't hear the beginning of the question. Are you saying for consultation services and the budget model?
Yeah, yes. It looks like some of the codes have been added, but the ones we use regularly are not in there.
Well, the consultation services and the budget model services are both on the CFD, and we are hoping to do that in a very future, in a near future release. We're waiting for it's hard to explain the issue that we're having, but once they get assigned a specialty code, we're able to then add them to the system, and so. Yes, for now you need to do the workaround and use them as people in organizations or add them as people in organizations that support me, and then add in the information on your service agreement to enter the information into MMIS about consultation services providers, or if they're using it, the budget model for CFSS.
Okay, so we don't actually have a timeline at this point?
Well,
Is that what I'm hearing?
It's in a very a near release. We should hopefully have it done soon, but again, we need to do testing and we don't know for sure. So we don't usually give a date. Is that true, Teresa?
Yeah, so what you're hearing is Beth saying is it has been logged as an issue, it has been reviewed as an issue, it has been prioritized as an issue, and it's actually going through the release process and being tested. And so that's really all we can say, because until it passes testing, we can't really say what release it's going to be in. But it's closer to release than just starting the process from new, is what you're hearing Beth say. So I would say coming soon is about all we can tell you, Angela. Sorry about that.
Okay, thanks.
Yeah, you're welcome.
All right, and next up we have Martha Francois, and I've unmuted you.
Hey, on the MnCHOICES assessment, under the action taken by lead agency, the denial section, program and services not available to you, the question came up recently by an assessor under the developmental disability waiver when we, if we're looking at a denial for the DD waiver due to maybe state plan services can meet your needs, that option, you do not meet other eligibility criteria, and then the ability to pick that option doesn't show up under that, the DD waiver. Was that intentional? And if so, why? Or is that a functionality issue under that waiver option?
We've received this as an enhancement request, and it is going through the process. So thank you.
Thank you. Thanks.
Yep, we're aware. Thanks.
All right, Teresa, I'm not seeing any other raised hands at this point, but we can definitely give it a few minutes to see if anyone has any questions that come up, but nothing right now.
Okay, we'll just wait a few minutes. If there aren't any other questions, then we'll just end the call early, but I don't want to do that until people have a chance to say, oh, wow, I have time, I can ask another question, so.
Yep, a couple people have popped in since we said it. So first I'm gonna go to Kim. I'm gonna yep, that's good. Okay, Kim, your line's unmuted.
CFSS has launched. Is the CFSS to PCA conversion worksheet still needed? I know it's still in MnCHOICES and on Partner Link.
So the conversion worksheet, if you did your assessment prior to CFSS launching, you would still use the conversion worksheet. If your assessment is after CFSS launch, you would just use the CFSS, the time that they're getting for CFSS for PCA. So it's not needed after, if you're doing your assessment after 10/1, but prior to it is. That's why it still exists.
Okay, thank you.
Thank you.
All right, and next I'm going to go to Lisa. So Lisa, I've unmuted your line.
Hi, this is Lisa from Wright County, and I am MnCHOICES reassessor, and then I also am one of the mentors. And I just have a question on the awake supervision question. With 1.0, we had direction that didn't necessarily say that 24-hour or that awake supervision meant they had to be awake all night. Is that still the same? Can we still use that same kind of guidance document in the revised application?
That is kind of getting more into a policy area. And if you could submit it for us, then we can give you
Absolutely, that's what I was going to do,
back.
but since there was time, I thought I would throw it in there. But okay, I'll put it on a policy question.
No, that would just take a little bit more consultation
Okay.
stuff. So
Perfect.
Thank you.
Thanks.
All right, next we're going to move to Maria Halbach. I've unmuted you.
Some time. I was hoping to ask a CFSS question, if that's all right. So we were under the impression that when you enter the 6 months, well, it was 3 months, 6 months of PCA for clients, that once they chose the consultation services provider, we could go back into that service agreement for 60 days to add that service line. Is that correct?
So you're asking about if for CFSS, if you're wanting to go back in once if they've chosen it within 60 days, that you'd be able to go in and add the consultation services provider that they chose.
MMIS. Yeah.
And MMIS, yes.
Yeah. Okay, because MMIS is saying no. And they have put a policy on their the resource center thing saying that if we enter, state plan PCA, those service agreements are not editable. So we are running into the problem of not being able to alter that service agreement once people choose a CFSS provider. So there's a real disconnect between what we are told that we can do as assessors and what MMIS is allowing now.
Okay. Let's. I'm going to take that question back because I'm maybe not fully up to speed on what's happening with MMIS in that situation. So I'd want to make sure to loop in some other folks about that. So
what? Okay.
So Beth, would we have Mariah then put in a help desk request form under policy so that you'd have something to respond back to, as well as an example to talk through?
If you'd be willing to, that'd be awesome. Otherwise, we can log it for the next office hours too and bring it back next month. But you'll probably want a response sooner than that. So it would be great to send it in.
It's really hurting our workflow because we have PCA clients who now they've chosen their CFS consultation provider, and the CFSS consultation provider will not meet with them until they have that service agreement, and we are not allowed to enter it. So it's like a now issue.
Yeah, no, I understand. I understand that that would be something that would be, I'll work to get an answer. Just send it in and then we'll for sure bring it back to make sure that the whole group knows about it next month as well.
Okay, but I mean, we need this resolved. We can't wait a month. So.
Right. Yep, nope, I totally understand. I'm here you, absolutely.
Okay, good deal.
Yeah.
I'll submit
Good.
that.
Thank you.
Mm-hmm.
Okay.
All right, we're going to move next to Emily Gerard. Emily, I've unmuted you.
Hi, guys. So it seems that at some point a change was made, and now that support plans that we created with like a transition reason, we now do have the option to revise them, which previously wasn't possible. I'm wondering when this changed and if we are okay to start using that. I couldn't find an announcement about that.
So are you saying before you couldn't revise a transition plan, or just that you had never used it
Correct.
and
When
were aware of it. You
we
couldn't.
first started
You
in this
cannot
program.
revise a transition plan.
Right, and now it seems that we can, and I'm not sure when that, like, there is a button now for
There is a button.
revise. So I'm wondering if I'm good to start telling our
No.
staff to use that option?
No, you will get stuck. So there is a button, and if you push it, it will not be apparent that you cannot finish it and complete it until you get to the end. Once you hit that revise option, it pretends like there is an assessment in place, which there's not, of course. And so it's going to start looking for assess needs and all that assessment information. So do not revise support plans for transition plan reason.
So is there a plan to either take the revise button away again or to fix it so that transition plans can be revised?
There is a plan to make transition plans revisable.
Okay. I'm guessing we don't have a timeline though.
I don't know what release it's planned for.
Okay. Is there a way to put anything into writing that explains that staff shouldn't be using that revise button? We're running into issues where staff are then running into exactly what you explained, and we couldn't quite figure out how they got there. And so I'm realizing now based on what you said exactly how they got there.
Yeah,
but
it is in the CFD. I know it's confusing when there's a button and then you push the button and it appears that it's an option. I didn't realize it was there either, so I'm not sure if it recently popped up or people just.
This is when I noticed it.
Yeah, you have to filter by support plan in order for that to pop up. So I don't know if people just weren't doing that because they knew not to. And now people are using the filter option more often, but the
and I know for sure it did not used to show
don't do
up.
that. Yeah.
Like I know, yeah. So I just don't know when that changed, but it's causing issues and errors that it just took a lot of digging for us to figure out how to even resolve it because it didn't used to be an option and I just couldn't find any communication around it. So yeah, I don't know.
Sorry for the hassle, but yeah, they are not able to be revised right now.
Is it possible to get the revised button to go away again until it's functional?
That is unlikely given the fact that that would also have to be a change that goes through the process. And
it takes time.
Yeah, and if we're looking at actually using it, I'm not sure we would remove it to add it back in, but it's something that we can talk about as a team as well.
Okay. Yeah, I mean, I would rather it stay if it means that there's going to be the actual function for it faster, but I'm just wondering if there's anywhere in writing that some instruction can be given so that staff
I wrote that note down for us to discuss after today's call.
Okay. Yeah.
So I keep track of what you guys bring up and what I think we need to talk about after the call, and then we walk through them all, and I put that on my list. So
sounds good. Thank you. That's good to know. Just the confirmation that we are in fact still not supposed to be using it, even though the button shows up now. So thank you. I appreciate it.
Sure.
All right. Next, we're going to move to Denise. And Denise, I've unmuted you.
Hi, I just wanted to speak to the 6-month Type B service agreements in MMIS. What our agency has found, I work for White Earth and I work with elderly waivers. But on the Type B service agreements, what our agency has found is that if you are putting a legacy service, so the PCA T1019, if you are putting that in and approving that, it will not allow you to go back and edit the service agreement because it is a legacy service. However, if you put your PCA and PCA supervision on there and you add a line for consultation, but leave out the provider number for the consultation, you can approve your PCA and your PCA supervision lines. And then you would change the header status on your service agreement to a T for partial suspense. leave the consultation line in suspense, then that will allow you to go back in and put in that consultation provider once you have received that information. But it will not let you do it if the header status is approved.
So in some ways, Denise, what I hear you saying is that it might be that is the workaround you're using for the issue that was presented earlier. Is that true? Am I hearing that correctly? Or are you just asking, is this correct? Is that steps that you're taking correct? I was looking for the question in it, I guess. Sorry.
I think that sounds like she's sharing a workaround with the group.
That's what I think so too.
We're still
Yep.
looking into that a little bit further. So thank
Yep.
you for sharing the workaround, and we will I'll work on connecting with home care. Thank you.
All right, next we'll move to Ann Gustafson, and Ann, I've unmuted you.
Yeah, hi, this is Ann. I have another workaround that we do here in Blue Earth County is we enter the PCA, we enter the supervision, and then we also enter the CFSS consultation, but we use the DHS provider code. And then it goes in, and then once they pick a provider, the provider goes in and submits the provider change form through MMIS, or actually through SAD.
Thank you, Ann.
All right, there's no hands raised at the moment, but we do still have some time, so we'll give it a few minutes and see if anyone has any more questions. All right, we got a couple more, so we'll start with Joe. Joe Mershman, I've unmuted you.
Joe Mershman, I'm a MnCHOICES lister with Rice County. I just want to make sure that I understand. So the person before it said that they were entering in the no pay code in the service agreement for the consultation provider. I guess I was under the impression that we were not able to enter that no pay code until after 60 days. Is that something that maybe I misunderstood, or could I get some more clarification on that?
Feels to me like the whole what's the right way to do it for MMIS entry is kind of out of our scope. And
Yeah,
you
I
guys are
think that
just
these need to be
sharing with each
questions.
other what you've done.
Yes, that seems to be what's happening, Teresa. And these are questions that would be really, if you go to those CFSS office hours, those are the questions that we should direct you to go there to get those answers, or to send it in for CFSS to make sure that you are getting the answer directly from them. We can tell you how it works in MnCHOICES.
Okay, thank you.
Yep.
Thank you.
All right, next we'll move to Kelsey Wickman. Kelsey, you're unmuted.
All right, I was just following up regarding that MMIS question regarding that service agreement and the T mode. So I was able to actually add more units to the PCA lines. I actually had to deny my line that I had in MMIS, and then I just re-entered that same line with the corrected amount of units needed as DHS had a 3-month window. They extended it to a 6-month window. So that is how I got around adding more PCA units to the current service agreement in MMIS.
Thanks, Kelsey, for sharing. But again, I think maybe having a conversation at the CFSS office hours is probably a right place to have this in case you guys are finding your workarounds. We don't know what they're asking you to do. Amy,
All
do
right,
we
next
have it?
we have,
Yep.
yeah, we have a couple more. So we have Angela Dostal. I've unmuted you.
Let's have an enhancement request regarding, because I feel like this is coming up more now that CFSS is what it is. But so sometimes we have situations where, like, for instance, they're Rule 185 eligible, and they're only going to be utilizing CFSS and case management. So they will transition to the case manager after I have done the assessment, the initial assessment, and I've put in the consultation services already, and we're still waiting on the plan. And instead of it coming back to me, we're trying to figure out the workflow from there on now that they have a case manager involved. And we've noticed that if I start the CFSS plan, the new worker can't revise a plan that I put in. It would be easier for workflow purposes if we could revise like that particular plan, I guess, is the one that seems to be the workflow issue at the moment. And I don't know what everybody else is doing to get around this, but we're still a work in progress regarding workflow.
I wonder a couple of things. If the person has, so I'm going to only speak to functionality, everybody else can jump in. So if the case manager is assigned to the person record and they're chosen as the plan owner on the revised plan, they should be able to make changes to the plan. If you've done both of those steps and they haven't, I would think it would require a help desk form, but am I not thinking about that correctly, policy? Sorry. I'm only
No.
thinking about functionality. Go for it, Beth.
No, you are thinking about it correctly. There's not a reason why the case manager can't jump in and start revising that form as long as they're assigned to it. And so
what we have noticed is if I start the form, they can't revise a support plan I started.
Even if if they've been assigned to the person record, correct?
Yep.
As a case manager.
Correct.
And the plan was created by you, so it's an approved status, right? Because it might be about the status. If the status isn't been approved, but I don't know.
The status has been approved.
Yeah.
So am I doing something, are we doing something wrong? Because when we attempted it, it wouldn't allow us to revise it. If somebody else initiated the form.
Yeah, I think I'd want you to send it in because there's no reason why a second person shouldn't be able to revise it. We've not heard of this before, so we'd maybe want to walk through it with you step by step to make sure that to see what's going on. So I really appreciate if you'd send that in. Thank you.
Okay, sounds good. Thanks.
All right, Teresa, we have one more hand, so we'll get to this one and probably bring us to the end of our time today. But I will unmute your line, and it's Margaret. You're unmuted.
Hi there. So this is actually a provider side question. So if this is not the appropriate forum, if someone can just direct me to the right place, that would be great. But I work with a few providers who have heard that the display names within MnCHOICES, it makes it sort of difficult to select the right enrollment. And I'm just wondering if there's a way for providers to figure out how they're listed and modify that. I also wrote this question out in the Q&A if it's easier to see it there.
Well, providers are loaded with information that we have in provider enrollment. From provider enrollment, so I'd suggest that they reach out to provider enrollment to review any details with them.
So our conversations with provider enrollment have not been able to verify exactly which name is pulled from the enrollment record over to MnCHOICES. So I was wondering if there's anybody who can confirm exactly which piece from the enrollment record is pulled for purposes of the display name.
And that's because that way you'll know for sure which record to request the change to, right?
Correct. Correct.
Okay. I just want to make sure I was hearing you correctly.
Yeah, so we want to make it easier to distinguish between, an enrollment record for TFSS versus HCBS versus private duty nursing. And we're just having trouble deciding which of the many kind of areas on the enrollment record to update.
Is that one that we would want submitted in as a help desk form? I don't know if Mary Hurdle's on today, so I didn't know.
Yeah, I think so, Teresa. It would help for us to have it on a form, and then we can look into it more.
Yeah.
Is there a way to submit a help desk request without a user ID? I just wasn't able to figure that out.
Sorry, I'm going to the help desk form itself. I can't answer that question without looking at it.
It seems it's a required, and maybe I can just fill in, NA. I haven't.
So you don't have a user ID?
No.
For MnCHOICES. Okay. Yeah, you could try NA. We can try it.
Yeah, I think you can just put something. I don't know if it has to be a certain amount of characters, but you can put something in there like, I don't have one or something, and it should let you do it.
Perfect.
Yep, and then choose policy. Mm-hmm.
Wonderful. All right. Well, at least you'll be on notice of the weird request that's going to come through. Thank you very much.
That's right. Thank you very much. So we are at time. So again, you can go back and review the past MnCHOICES office hours calls by going to the Disability Services Archive, and you can go back and get the PDF and listen to our calls. And then you can also, if you want to stay up on what's going on, you can sign up for e-lists from both the Aging and Adult Services Division and Disability Service Division e-list. And then those also have archives, so they're also available to you. So with that, I'm going to close out today's call. Say thank you very much, everyone. This was always a good conversation. We appreciate the conversations with you very much, and you have a really good Friday, and we will see you in another month. So thanks, everybody.